Hi, friends. This is Dr. Ravi Kamapale. I'm an infectious disease, wound care, and obesity medicine doctor in Atlanta area. Here we're presenting a patient who has had a surgical wound, and essentially this is a wound that had ulceration on the post-op knee surgical wound. And we used a unique approach with continuous diffusion of oxygen treatment on a platform-based approach wherein we empowered the patient on her own healing, and we used a high-touch approach to wound healing. And I just wanted to present this unique approach, and hopefully this will help us understand how we can deliver comprehensive, patient-centric, whole patient approach to the holes in the people that have been causing huge morbidity and mortality. We are located in Georgia, in Atlanta market, and our website, nobadbugs.com, and our X handle at Wound Physician, and hashtag removing barriers to healing. And like I said, we're working on building a telemedicine solution that is comprehensive solution for infectious disease, wound care, and wound healing betterment. So this is a 73-year-old female who happens to be a photographer too, and has had history of problems with osteoporosis, had Prolia injection, and also has had spinal fusion too. Has also suffered with arthritis, ending up with the knee replacement on December 16, 2024. And post-operatively, the knee area on the right knee ended up having areas of ischemia, and she was started on oral antibiotic therapy, and she presented to our office, and basically in early January 2025. And she started also complaining of different problems with peripheral neuropathy that has been bothering for all the while. And we initially, after initial treatments, options were applied. Other options to improve the oxygenation to the area were thought about, and also we did test her vascular status, and also started something called as continuous diffusion of oxygen, and we'll talk a little bit about it. And she started a local care with removing the devitalized tissue at each visit, and tolerated it well. And the knee went on to heal in March 6, 2025. And as a part of the workup, we found out that she has significant issues with the neuropathy, but also we applied a continuous glucose monitor and found out that she has some episodes of hypoglycemia and also body composition analysis with sarcopenia. And despite all that, also, she has significant family history of diabetes, and she has a hemoglobin A1C of 5.6, but she gets these cold and clammy sensations in the extremities, and problems that are appearing to be metabolic in nature. So this is her initial picture on January 7th, 2025. And she ended up having a presentation, and we started using continuous diffusion of oxygen and started applying betadine to stabilize the scabbed area with ischemic skin, with vascular optimization having improved, with main vessels being optimal. But she appears to have, with all her problems, some compromised vascular supply with small vessel disease, which also is showing the symptoms of neuropathy with autonomic neuropathy kind of changes. And we worked on her, let the tissue separate, and started working on removing the tissue that was separating from her margin by autolysis, and continued continuous diffusion of oxygen treatment, and over time separated it and let the tissue evolve. And as you can see, as it started separating, we continued with the local care, and she changed that continuous diffusion of oxygen pad at home every 48 hours. And essentially, if you see, she went on to heal with a good, nice scar. As you can see, she did have a ankle brachial index that was fine, and also basically she did have small fiber neuropathy, and microcirculatory response was severe, and that likely was the cause of her problems with her wound healing. And also, as I mentioned earlier, she had issues with sarcopenia that we found out. If you see her initial presentation in January, we did body composition test to see what her body composition is. And if you see, she had less skeletal muscle mass and lean body mass, which is a combination of bone and muscle. She had to gain around 9.9 pounds of lean body mass. And when we analyzed and empowered and educated her, if you see, her BMI was only 19.5, and her BMI is improving. And also, if you see, she gained around 2 pounds of lean body mass. So we changed and gave her dietary advice with low carb, high protein diet, and her symptoms are also improved. And like I said, discussed earlier, we applied this continuous diffusion of oxygen to her, and she was one of the patients that was not part of our retrospective chart review that we did, where we presented at Symposium on Advanced Wound Care, where we retrospectively reviewed 13 of 15 patients. 8 were diabetic and 8 were non-diabetic, 5 diabetic. And that showed that there was sharp increase in granulation after sharp debridement and active local care for standard of care, wherein we provided guidance for nutrition and also used oxygen along with standard of care. So this was the poster that we presented, and the links are available and on the social media a lot. And as you can see here, improving oxygen and improving in insulin sensitivity will help healing. And these cases were presented on this QR code you can see. So the interplay between oxygen and insulin sensitivity is crucial for wound healing, particularly in diabetic patients. Though she was not diabetic here, she was having microvascular problems, significant family history, hypoglycemia episodes. All this improved once the nutritional aspect was also improved. Here, what you saw is the key factors being oxygen is essential for cellular metabolism and energy production and collagen synthesis. And insulin promotes glucose uptake, energy production, and cellular repair. Whereas in the state of insulin resistance, the glucose uptake is harder and more insulin is given sometimes, which is the current standard of care, whereas insulin sensitization has to be the standard of care. And impact on wound healing is because of hypoxia, it impairs healing by reducing cellular energy function, and insulin in the presence of insulin resistance leads to chronic wounds due to cellular responsiveness that is reduced and energy availability that is reduced. And benefits of oxygen in insulin sensitivity improvement include combination approaches that promote wound healing, reduced healing time, and also the strategies of supplementing oxygen to enhance tissue oxygenation, insulin sensitization, medications, and nutritional support with dietary approaches that improve insulin sensitivity has to be the right way to do this. And appropriate dressing options and continuous monitoring is the key. That's what we did for her, wherein we gave her a platform wherein we were able to develop a remote patient platform that we helped not just lip service in care delivery model, but also actionable high-step approaches in compassionate healing. And that's what we did to help her. And as a part of that, we also worked on taking a patient's perspective in this healing process. And I want to share this patient opinion on the patient's perspective, but also show you that here we have this is her initial presentation on this platform. Here we are able to give her access wherein she's able to take her pictures, and they come to our platform. And here you are able to see that when she's at home and doing the dressing changes, she's able to be comfortable that those pictures come to us. And here we are able to give her a thumbs up and give her a comment, okay, and try to tell her that, hey, the wound is stable, you're doing good, don't worry. And then she gets that, and then she's happy about it. And basically, we end up continually monitoring her. And this high-touch approach to healing has to happen. And this has to happen for each patient, and empirically, so doctor platform availability so that the doctor also can take the pictures when the patient comes. And being there for the patient is a key. And hopefully, these tools, techniques, and processes that were integrated will help the overall understanding and care planning. Thank you very much.